For the majority of people that develop back or neck pain, it's usually osteoarthritis or a wear and tear issue that develops over time and leads to inflammation in the discs and joints of their neck or back. As you know, as we walk and move around every day, the spine is taking stress and being degenerated on a day-to-day and year-to-year basis. So as we do age, the spine and the strength of it starts to have more deterioration, and it's more prone to developing inflammation or irritation that can become painful for patients. Being overweight is likely associated with spinal disease for a number of different reasons. One issue is, of course, if somebody has a large girth that puts more stress on their lower back, and mechanically the back takes more stress and therefore can break down more quickly. It's not also atypical that if somebody is overweight, that they don't have a strong core, and the core is what helps to stabilize your lower back. And with a weak core, your back joints and your back discs take a lot more stress. So there's definitely a direct link with being overweight and having back problems, specifically for those reasons. And of course, people that are overweight tend to exercise less. They tend to have a weaker core, and they tend to put more stress on their lower back in that setting. I think everybody has a different pain tolerance level, but certainly any type of pain that's short term, such as 1 or 2 weeks of discomfort that slowly goes away and resolves with icing or use of Advil or Motrin, that type of pain is not typical, and they should present to their medical doctor for evaluation and possible referral to a specialist in that setting. We also recommend that if patients have any neurologic symptoms where they're getting weakness or numbness, those are much more serious signs of a disc problem or a spine degeneration problem. We ask them to present to their doctors immediately with those type of symptoms. So diagnosis involves a number of different components. One is the history, trying to find out how long and how significant the patient's symptoms have been. The second part of it usually is a physical exam to find out how the nervous system is functioning. And then the third part typically involves some type of imaging, with the most common type of imaging being an MRI of the spine, whether it be of the lower back or the neck. If a patient has had persisting symptoms over 1 to 2 weeks, despite treating it with home remedies such as icing, rest, and use of Advil or Motrin, we recommend they follow up with their medical doctor for further evaluation. The conservative treatment for neck and back pain usually involves physical therapy as one of the primary treatments, and we recommend that on almost all of the cases that we see. If a patient has continued symptoms despite further treatment, such as physical therapy, continued use of anti-inflammatory medication, then they can consider pain management. Pain management is a general term that describes both managing pain with medication, but more significantly using injection treatment to try to target areas where there is inflammation of the spinal nerves or inflammation of the spinal joints. So that's kind of the second tier treatment for continued symptoms of neck and back pain. If somebody were to fail to improve with this conservative treatment plan of therapy, pain management program, and they remain symptomatic, then they typically present for a surgical evaluation. From a surgical standpoint, we have a variety of surgeries that can be considered, from very minimally invasive that are outpatient and have a short recovery, to more complex procedures that we actually reconstruct the spine, involving screws and rods to reposition the bones in the spine. So it's a very broad spectrum of surgeries, with the majority of the surgeries being more on the minimally invasive end for most of the problems that we see.